experience now, having done in-text and having done simple crossing, and Danielle is going to disagree with me on this, but in our experience, we no longer do simple cross-linking anymore because we feel very confident that adding the laser is going to improve their quality of vision, going to make the cornea more regular, and going to help the patient, give them less astigmatism. So once we're going to the step of cross-linking, removing the epithelium and giving them this uncomfortable procedure, we're going to do a little bit of laser, which you saw takes a few seconds, but we're going to improve their quality of vision with that. And that's sort of the goal. So our criteria to treat patients with crossing would be 26 and under. The moment you're diagnosed with keratoconus, if it's in one eye, just that eye, and the other eye you observe closely. But anyone diagnosed will treat. Over 26 years old, we will typically ask for history. Is there a progression? So if in the last 3 years there's obvious progression, either worsening refraction or someone's doing keratometries and they have a diopter more, basically a diopter more of astigmatism or keratometry, we know they're sort of showing objective signs of progression. Then we say, okay, this is now an unstable patient, and we're going to treat them some more. I'm competing with the surgery. His eyes are going back and forth. Maybe I'll shut up for a minute while here does Lasik. So I'll describe it. This is a retouch, okay. So retouch here. Here I did a little mark on the cornea. The reason we mark the cornea is basically so it's easy to put the flap back and see what you're doing, because with the microscope the cornea is perfectly clear, so when you want to put the flap back, it's just easy to line up those blue marks of the marker. A flap, as Pierre said, lifts very easily, typically, not always, but typically, because the only place a Lasik flap scars is here. You've all seen post-op Lasik. And there's a reason it scars here. Does anyone know why a Lasik flap only scars typically in the periphery? Because of the epithelium. So what happens in the periphery is different from everywhere else. In the rest of the cornea, you have stroma meeting stroma. So it's from an immunological perspective, it's the same tissue, and it doesn't get a reaction. Where we cut Bowman's, right here, where we cut Bowman's, the epithelium tries to grow in and gets into contact with the stroma and causes a fibrotic reaction, scarring, fibrosis. And that's why, lucky for us in Lasik, it basically zips. It's like a zipper. It scars all the way around the edge, and if you see the way Pierre lifted that, you just take a dissector, and it's literally like unzipping the flap. And a relift is a very simple technique. Very, very low complication rate, as Pierre said. Intra-op, it's almost nothing. Post-op, they have a much higher